Good morning, everyone, and welcome to this meeting of the Perth and Kinross Integration Joint Board, Audit and Performance Committee. To start, can I ask if we can have the apologies and any substitutions for this meeting today?
Thank you, Chair. We have apologies today from Ronnie Erskine, as well as Evelyn Devine and Hamish Dougal. Patrick hasn't joined us at the moment, but we're hoping that she'll join us soon.
Okay, thank you to the clerk for that. Moving on now to declarations of interest, can I ask if any members have declarations of interest in relation to the items of business on the agenda today? Okay, I will take that as a no. Moving on now to item 3, which is the minute of the previous meeting, and that meeting was held on the 22nd of June this year. Can I ask members if they're happy that that minute is an accurate record of meeting?
Agreed.
Okay, thank you. Moving on now to item 3.2, which is the action point update. And I'll hand over to the Chief Financial Officer to give a brief verbal update on this. Thank you.
Thank you, Chair. We're in the fortunate position where all actions arising at previous meetings have now been actioned appropriately, so we haven't brought forward any specific actions. However, I would note that under matters arising, I was intending to bring forward an action relating to Risk Champion, which is in the minutes. That perhaps should have been in the action point update, and we'll make sure it is for future meetings. Within that, we've agreed to discuss with the Chair and the Vice Chair taking up the recommendation made in a recent audit report in the appointment of one of our IGB members as a risk champion to the board. We have had initial discussions with the Chair, and we're seeking to have conversations with the Vice Chair when he returns from leave. I think it's this week. Bob Benson's due back from leave, so we will hope we should have a very clear position on the appointment of a risk champion for the next meeting.
Okay, thank you for that update. Can I first, before we move on to the next section, ask if any members have any additional matters arising that they would like to raise from the minute of the previous meeting? I'll take silence as no. Okay, thank you. Right, if we move on now to section 4 of the agenda, which is the governance and assurance section, and the first paper that we have is item 4.1, which is the strategic risk management update, and I'll ask the Chief Officer to speak to the report. Thank you. Do we know if the Chief Officer is in the meeting? It seems
he's not at the moment, Councillor Purvis. He's having difficulties joining currently. We're trying to get him in.
Okay, would the Chief Financial Officer like to speak to the report instead then?
Yes, very happy to. At the last meeting of the Audit and Performance Committee, we described some of the challenges that COVID presented to us as officers in not only ensuring that we had a COVID risk register and we're overseeing that and taking the necessary mitigating actions, but also in relation to the roadmap we'd set out in relation to the strategic risk register. We had at the last meeting set out timescales which we were working to, but what we've come back today is two things. We've come back today with the COVID risk register. We felt that it was important that the Audit Committee understand the continued efforts that the partnership are taking to mitigate a number of risks that sit at the heart of our COVID response and renewal plans. So we've presented them to the committee today, and that COVID risk register is very much consistent with the approach taken in the parent bodies and in the other IGBs, and the importance of that has been recognised across Tayside, that it's important that we have that and are mitigating those risks. However, what we've also set out for the committee today is a revised roadmap that will see that COVID risk register and those risks brought forward in light of the strategic risk register and a revised strategic risk register that's done through a COVID lens, if you like. And certainly the work that we've done so far to take that forward, we can really kind of see that the COVID response and renewal is going to have a significant impact on many of those risks, some of them positive, some of them are perhaps increasing risk. Financial risk would be one of those at the moment, but that's why this work of bringing the two risk registers together is really important. The timeline that we've set out is now extremely challenging. We recognised that last week. And we wondered whether we should be bringing forward a revised timeline and tabling that today. Part of that is to do with the fact that we've had a local COVID outbreak that's required a huge focused effort of the management team, and has meant the work that we planned on a number of things, and including the strategic risk register, is now at risk of being compromised. However, EMT agreed last week that we still want to do our very best to comply with the timescales set out in the roadmap presented today, but we would want to just flag the risk to management capacity of the ongoing COVID response. Happy to take any questions, Chair.
Okay, thank you very much to the Chief Financial Officer for that introduction to the report. I think it is very useful to have the COVID risk register set out, and as I think we discussed at the last meeting, we're very keen to see these two documents brought together at some point. I mentioned when we had pre-discussions in advance of this meeting that one of the particular concerns that I had was about how existing risks that we've already identified might affect the challenges that we're facing as a result of COVID, and vice versa, how risks that are new because of how we're having to tackle the coronavirus might affect our existing risks. And we have seen that in a slightly different context with things like flood events in the council, where that has affected the capacity of the council to deal with some of the other things. So I think it's really important, particularly as we look towards winter planning as well. I might come back to that as a question once I've asked if any members have any questions that they would like to ask on this report, if you could indicate in the chat. Councillor Duff.
Thank you, Convener. Yeah, I just wanted to ask a couple of questions around about some of the risks there. Workforce resilience. Obviously, the well-being of staff was seen as a risk, and I'm glad it's been mitigated down. But I just wondered, are we seeing any concerns about absence rates within staff in general during this period?
If I could come back in, Chair, thank you for the question. Interestingly, that's something that the executive management team looked at last week. And my recollection, colleagues may be able to come in and support me, but my recollection was that on the health side of things, interestingly, there was not a major impact. We were seeing some impact on the social care side, and that was something that we were investigating. But what I would suggest I would like to do, Councillor Duff, is just double check that my answer there is accurate, and provide committee members with a short briefing following the meeting on sickness absence rates, on the impact and on the actions that we're taking, if that were felt appropriate.
Okay, thank you. Did you have a further question, Councillor Duff? Oh, I think you're muted.
Is that better? There we go. It was under number 6, which is to do with sustainable digital solutions, and it talks about the rollout of technology-enabled care. And I just wondered if I could get an update where that was.
Thank you, Councillor Duff. I've got a colleague, Sandy Strathern, with us today, and he's very much supporting the leads who are taking that forward. Sandy, I wonder if you could give an update on where we are with the plans that we have.
Sorry, I was muted and I've just come online. Can I get the question again, please?
Sorry, yes, Sandy. It was in connection with the risk register number 6 about sustainable digital solutions, and there is an entry there that talks about fully roll out technology-enabled care, ensuring digital solutions are key to any future commissioning models. I wondered where we are with the rollout of technology-enabled care.
So, Councillor, just now we have our new tech and strategy digital boards up and running, and we are developing the timelines and the action plans to roll out our tech and digital strategies. These boards are fairly new, but they're embedded now, and we're also working with NHS Tayside inside their national strategy group as well to join up other activities. So there's a lot of planning for rolling out of tech over the this coming year.
Okay, thank you for that. Thank you, Chair.
Thank you, Councillor Duff. Can I ask if there are any other members who would like to ask questions on this report? Okay, in the absence of any further questions being indicated, I'll ask my question then in relation to some of the comments that I made earlier about dealing with different risks, both COVID and existing ones that we deal with every year. And I wanted to ask about winter planning and to what extent the preparations are along the way for that, when it will be coming to the IGB, and also what the additional considerations are this year in light of some of the things that have been discussed nationally about trying to get additional people vaccinated for the flu that we have every year. So if perhaps someone could give some more detail on where we are with those discussions.
Chair, should I come in at this point?
Yep, Chief Officer.
Thank you very much. Firstly, to apologise that I was unable to join the meeting until a few minutes ago due to some technical difficulties. I was only being allowed to see it live rather than participate, but I'm here now. In terms of winter planning, there's a number of factors that we're having to take into account. We've got a significant piece of work underway, which is around ensuring that we have in place sufficient capacity to deliver on an expanded flu immunisation programme, which will commence towards the end of this month. We're working closely with colleagues in the NHS in terms of the pan-Tayside approach to this, but locally we're also putting in place our own arrangements, and we've secured significant capacity through volunteering from our nursing workforce. We're working closely with the local GP practices to clarify what contribution they'll be able to make, and we're also mindful of the potential for community pharmacists to provide some capacity there. So there is a significant undertaking being progressed, and we're confident that we'll be in position to deliver the flu immunisation programme from the end of the month. More broadly, in terms of winter plan, we will be bringing a report to the IGB on our winter planning provisions on the 23rd of September. We've very much aligned the work that we're doing with our COVID response and remobilisation, recognising how that has contributed to supporting capacity and flow, tackling delayed discharge, creating capacity within the acute hospitals and community hospitals, and we retained some provision in relation to intermediate care that we would be able to lever in if that was necessary. So probably just to say that we'll capture all of this in a fuller report that will come to the IJB on the 23rd.
Okay, thank you, Chief Officer, for that. And just one additional point, if I may, in relation to the winter planning, it has been raised with me by a number of constituents with another councillor hat on about concerns, particularly for those in rural areas, and I'm sure that Councillor Duff might agree with what I'm about to say, that it might be quite difficult for people who are reluctant to go on public transport at the minute, either because they don't want to or because routes have been reduced in trying to get into pharmacies or doctors' surgeries to have the flu vaccination. So I know that we had talked about, as part of the primary care improvement plan, trying to do more things out in our communities, and I think it would be really good, whether it's in community halls or if there are other ways of dealing with it, if we could try and look to provide some flu vaccinations out in some of the more rural areas, because that is something that's been raised with me now by a number of different constituents who are concerned. But I don't know if the Chief Officer wants to make any comment on that, or otherwise we can move on.
No, just to acknowledge that that's something that we'll be seeking to do, and we'll take note to ensure that we provide the IJB with some assurance in that regard when we report on later this month. We will also be reporting on the progress with regard to the primary care improvement plan at the next IJB, so hopefully that will provide some further information that we'll be able to assure members.
Thank you, Chief Officer. Okay, in the absence of any further questions on this report, can I ask if we are happy to note the recommendations in the report?
Happy to note. Thank you.
Okay, moving on now to item 4.2, which is the audit recommendations update, and I will ask the Chief Financial Officer to introduce this report.
Thank you, Chair. Colleagues will be aware that at the last Audit and Performance Committee we weren't able to bring forward an update on audit recommendations due to the impact of COVID on capacity. However, we're pleased to bring forward an update today. However, before just talking about that update, I want to formally apologise. There is an error in the report in relation to the number of recommendations. I'm not sure if anybody has spotted that. I've spotted it first thing early this morning, in that the recommendations columns don't add up appropriately, so apologies for that. However, the overall figures do stand. We have had 45 recommendations overall. It should be 38 of those are complete, 1 is part complete, and 6 are overdue. So apologies for that. There's been an error just in the addition of that table. In relation, it's worth noting that error in part arose because what we've done for this committee is add in the clinical care governance recommendations. Those were removed when we understood that a separate subcommittee of the IGB would be set up and the reporting line for those recommendations would be to there. As colleagues know, there has been ongoing discussions about that committee, so in the meantime the committee, Audit and Performance Committee, agreed that we needed somewhere for those recommendations to be reported, so they've now been embedded back in to the audit recommendations position, and that's what's before the committee today. Taking clinical care governance recommendations first, and certainly the Chief Officer may want to comment on these better than me, but you can see some significant progress with the majority of recommendations now complete and outstanding recommendation in relation to an annual report that should come forward, and that's in train, and regardless of which committee, that the plan is that will be done and will come to the Audit and Performance Committee in the intervening period. So in terms of the outstanding other recommendations, we have 5 outstanding, and Three of those are in relation to strategic planning actions that to a large part have been impacted by COVID. Gordon may want to come in and speak to this, but in relation to the work around the strategic planning group and the strategy groups, and our desire to move these forward in a slightly different direction has been impacted by COVID, but these are discussions that are now beginning to happen around the executive management team, and we should see progress in respect of these. There's another recommendation, couple of recommendations that are in relation to management and corporate support capacity. And again, Gordon, I'm sure will want to come in and talk about these. A further recommendation is in relation to the budget setting in relation to reserves. That is a recommendation that is partly implemented, and we've been in discussions with colleagues across Tayside to find out the best way of implementing that recommendation in relation to budget setting and reserves. So we will have a full update on that for the next meeting. Can I hand over to Gordon, who I'm sure will want to talk to some of those, the two areas that I've mentioned.
Thanks, Jane. So certainly in terms of clinical care and professional governance, the IJB members will recall that we had a development session last month in which we provided a report outlining the activity that is underway in relation to clinical governance and providing hopefully a strong degree of assurance that there is a lot of work being progressed. What we've yet to do is to compile that into an annual report and clarify how we're going to report in future. An issue that perhaps is linked to the wider issue around the imminent review of the integration scheme and some of the work that the IJB members have been taking forward in relation to governance. However, clinical and care governance will be the subject of an annual report. As Jane said, I have to do some work with the Chief Social Work Officer and the Associate Medical Director to bring forward some proposals to the IJB on the basis of the discussions that we had at the development session. More broadly, in terms of some of the longer standing recommendations that are included in the audit report, these have certainly been impacted on by our focus and prioritisation of COVID activity for the last, whatever it is now, 6 months. Members will recall that I had brought forward a proposal to develop strategy groups in relation to care groups that would be the vehicle for us advancing some strategic planning in relation to those groups, taking into account local considerations and circumstances and the relevant national strategies that should be shaping our direction. We still have to progress the work of those strategy groups. Some of them were already in play, some of them need to be instituted, and we, as Jane has indicated, have had some discussion within the executive management team about progressing that. Similarly, we have plans being developed in relation to revitalising the strategic planning group. We recognise that it has not been working as effectively as it should. And indeed that was a challenge before COVID, but that we are now in a position to recalibrate and revitalise the work of that group in anticipation that the various strategy groups would feed into the strategic planning group, and that planning group at a strategic level would review the delivery of our strategic commissioning plan and feed into the work of the IJB. So that's work that we would now expect to be able to focus on, notwithstanding the challenges that we've recently experienced with a significant local outbreak of COVID, notwithstanding the winter planning challenges, and hopefully in the absence of a significant second surge of the pandemic.
Thank you for that, Chief Officer. I'll perhaps start with my questions first this time, and then if other members have questions, I'll take them afterwards. The first one was about the hosted services and those services that are hosted by Dundee an Angus IGB. I know that that's one of the longer standing recommendations. The point made in the report here is that it's going to be considered as part of the review of the integration scheme. I'm just wondering whether it would be possible to, I presume there are reports that are produced for these two IGBs in relation to these services, that while appreciating that we might want to have a more long-standing arrangement that we put in place eventually, wouldn't it be possible to bring these reports to the IGB just so that at least we're aware of any emerging issues and try to get some assurance about how those services are being delivered? And so just wondering, Chief Officer, if that's perhaps something we could consider as an interim solution.
Yes, that's a very helpful suggestion, Chair, and I'm reflecting on the fact that, as you've pointed out, these hosted services report in any case, so there would be a way of obtaining an extract or copies of reports that perhaps either go to Angus and Dundee's IGBs or indeed to NHS Tayside's Strategic Risk Management Group or to the Care Governance Committee. So yes, that's something that we could probably initiate fairly swiftly whilst the review of the integration scheme is taking place.
Okay, thank you, Chief Officer. And linked to the questions about the strategic planning group, particularly given the references to community engagement there, but just thinking more broadly for a second about some of the ongoing programmes of work for consultation and engagement that are taking place, both in NHS Tayside as part of transforming Tayside, but also in Perth and Kinross Council with the Perth and Kinross offer. I'm just wondering what the IGB and the Health and Social Care Partnership are doing to link into these. Just to give one example, I know that there were a number of comments about social care and about the provision of social care that have come through some of the recent consultations that the Council has been doing as part of the offer. So I'm just conscious that we want to make sure we're linking in with both of these initiatives, and perhaps the Chief Officer could give some assurance on how we are doing that.
Certainly, yes. I mean, probably important to reflect the fact that I am an active member of the Council's Chief Executive Group and of the Executive Officer team, and I bring back from that the information that's being progressed and developed within the Council into the Health and Social Care Partnership. I think there's a number of ways in which we can build on what is already a fairly effective collaboration. I think at the community planning partnership level, we need to reflect on how can the Health and Social Care Partnership have more of a locus, and how can we ensure that the shared agenda around health equalities, early intervention, community strengthening communities is better advanced through the synergies that forum can provide. What we are doing within the partnership at the moment, within the Health and Social Care Partnership at the moment, is looking at assigning lead responsibility to a number of our service and locality managers, and one of those would be around communities and community development. So I would very much see that as being the post that would be supporting the activity that's already going on within the partnership, but recognising that one of the positives, if we can take any positives from COVID, is around the ways in which local communities have mobilised and demonstrated community resilience and support. There's something there that we need to capitalise on, that we need to support, that we need to align ourselves with. So what I would be anticipating is that the lead for communities would take on the responsibilities in and around this area, bringing that back and presenting into the Health and Social Care Partnership the opportunities for us to think about how we can make stronger links, both, as I say, to community planning, but also to the Perth and Kinross offer. The other aspect of it moving forward is I think that there's an ambition within NHS Tayside to reappraise the public health offer. So as we know, the director's post, the director's now retired, and there's a new director post to be appointed to. Grant Archibald has a very strong commitment to public health and is very keenly looking at how he can build the provision and capacity to strengthen some of those relationships that we've touched on. So I think there's a number of areas in which we can capitalise, and the Chair is quite right to point out the fact that we shouldn't miss those opportunities to collaborate more effectively, which we're committed to try to do.
Okay, thank you very much for that, Chief Officer. I think that is very promising. I know that there is strong engagement with some of the officers who sit on local action partnerships, for example, but as I was mentioning in discussions with some colleagues last week, that there are perhaps other opportunities to use those as a vehicle for engagement for the Health and Social Care Partnership, but also, as the Chief Officer has quite rightly said, there are a lot of excellent examples of community resilience that we've seen during the pandemic. And also some other existing models that we've talked about before, such as the Care and Wellbeing Cooperative in Highland Perthshire, which I know that I'm particularly keen to see replicated in other areas of Perth and Kinross if we can. Moving on, are there any further questions from other members of the committee on this report? Councillor Duff. I think you're muted, Councillor Duff.
If I could just find the mute button, there we go. Yeah, obviously the report found an issue with the strategic and corporate planning capacity. I think that was going back long before COVID-19 came along. But obviously the pandemic has highlighted the need for some enhanced corporate and strategic planning capacity, and I just wondered what actions have been taken, perhaps in the interim, to try and fill that gap.
Chief Officer?
Chair, I'm happy to kick off, but I'll perhaps bring in Chief Financial Officer just to supplement what I'm about to say. What we've been actively looking to do is the realignment of portfolios within the existing capacity, and then a bit of a gap analysis to look at what are we able to deliver on by priority and effectively with the capacity that we've got, and what are the aspects where we are exposed to a degree of risk because we're not going to make the progress perhaps that we would like, but certainly that the IJB and perhaps this committee would like, in and around issues to do with governance, risk, audit, planning and performance. So Jane has ably progressed that and has some ideas about how we might make best use of the resource we've got, but we're actively looking within the EMT at the creation of additional posts to give us the opportunity and capacity to take forward some of the areas that we have not been able to take forward. We also need to reflect on the potential for us to benefit from developments that are taking place within with our statutory partners. So we need to think about how we can align and avoid duplication and benefit from activity that is underway both in Perth and Kinross Council, but also with NHS Tayside. And there's something there about the contribution towards our corporate support that the partners bring to the table. That being one of the key issues that we would like to progress in the review of the integration scheme. Jane, I'd be very grateful if you would build on that with any additional information you'd want to share with the committee.
Thank you, Gordon. No, you've covered that, very well, Gordon. Though I suppose the only point I would make is that for the corporate team and the executive management team as well, COVID brought with it an opportunity to almost reconsider standard roles and for everybody to work much more flexibly, picking up tasks and priorities regardless of their their job description. And that's been a real, I think, a really positive outcome of the way in which we've been working, and it's meant that as we've then looked to maximise you know, the support that we've got available to us, everybody's come at it with a level of flexibility, creativity, and positivity, and been willing to you know, shape and flex their roles, and that has definitely created a level of capacity that the partnership has benefited from, and we now want to build on that, as Gordon has said. But we recognise there's a further step up in capacity required. We've identified where we think that needs to go, and we're progressing with fixed term recruitment at the moment, and identified the funding to actually be able to progress that. So a real positive in many ways that's come out of COVID in terms of creative and flexible working, that's really given us a level of resilience that we're quite proud of, I think.
No, I would agree. Thanks very much. That's very helpful. Thank you.
Thank you.
Chair, could I ask? Sorry, it's Pat Patrick. I've had to join by conference call. I don't know if you can hear me.
Sorry, I was just about to say that you had joined us, but on you go.
I'm sorry, Chair. No, my question was just about community mental health, because you know, I'm pleased that we've had an opportunity to review the strategic planning capacity and the realignment of portfolios, as Gordon has said, that's in the report. But it was about community mental health, because we talk in the paper about the strategic risks regarding mental health and operational responsibility of that. But I take it I'm on the right paper here. We don't mention community mental health, which from the report that was produced looks as if it's an area that maybe we need to get a bit more focus on strategically in terms of planning and capacity and maybe even risk. And given the impact of COVID, that's likely going to increase the demand for mental health services. Thank you.
Thank you. I think it might be just because on this report these recommendations have been specifically drawn from recommendations from other reports, but I don't know, Chief Officer, more than happy for you to comment on this.
Certainly, yes. Can I perhaps firstly take the opportunity to briefly refer back to something Jane Smith said? I think it would be quite remiss of me to fail to recognise the way in which colleagues in corporate services have worked throughout the COVID pandemic, because of the versatility, flexibility, creativity that they've developed. I just want to acknowledge that, you know, colleagues in corporate services have established a workforce matching unit where we were able to reprioritise and retask staff. They've led on the mobilisation plan and its various iterations. They initiated very early on a command structure that made our response to COVID far better organised and more robust. So I just want to pay testament to their contribution, for which I personally am very grateful. Those highlighted some of the areas where we want to identify, we want to bring in a bit more capacity, and colleagues, members may well be assured that some of that is also around IJB and committee support as well as business support. So we've got some plans in that regard that Jane referenced. If I could move on to the question about community mental health, though, within our mobilisation plan, we have encouraged, received and funded bids from 7 third sector organisations in Perth and Kinross to ensure that they can provide enhanced levels of support to local communities and build resilience in terms of community mental health and individuals in those communities' mental health. So it has been an area of some considerable focus, Pat, and remains a key priority. And one of the questions that you've always been keen to challenge us on, which I don't know that we've necessarily got a good response to yet, is about the longer term impact of COVID on public health. And whilst we know and we're beginning to hear as the science emerges and our experience develops, that COVID can have significant ongoing physical challenges to people's health for weeks and months after recovery, for a small number of people. We need to also recognise what COVID might be doing to people's mental health, and that might well be merely because people become the worried well, or people are anxious, or the effects of a lockdown on social isolation and on not allowing people to have the connections and networks and relationships that would support them to maintain good emotional health and well-being. So we're very sensitive to the fact that we're increasingly going to be seeing evidence of this. And whilst the funding that I alluded to that we've awarded to these organisations has by necessity been time limited to the end of this financial year, that really shouldn't be precluding us from looking in the context of our broader community mental health strategy at what services and provision is going to be necessary to respond to the longer term impacts of COVID-19 on our citizens and communities.
Thank you for that, Chief Officer. And just very briefly to add, I know that we had a discussion at the last Integration Joint Board about community mental health and the community mental health strategy. And I know that there was some concern from members about that might be taking longer to do. And I know that a proposal was circulated with a timescale which would ensure we have a new community mental health strategy in place by the end of the financial year. So I think that's very positive, ensuring, of course, that we properly engage with the wider community and stakeholders while we do that. I don't know, Kilpatrick, whether you had any further questions. It looks like Pat is trying to speak, but I can't hear anything. Okay, in the absence of any further questions, then can I ask if we're happy to note the progress on the recommendations that's in the report?
Happy to note, Chair.
Okay. Thank you very much. If we move on then to item 4.3, which is the internal audit strategy and plan for 2020-2021, and I'll ask the Chief Internal Auditor, Jackie Clark, to speak to this report. Thank you.
Thank you, Chair. The strategy for the development of the internal audit strategy for the plan is to provide a risk-based internal audit service covering what remains of 2020-21, which is consistent with the public sector internal audit standards and will be delivered jointly with NHS Tayside's internal audit function. I'd like to draw attention to the proposed assignments as detailed in section 3. In addition to finalising the 2019-20 internal audit plan with the outstanding report that's to be considered by this committee, being that on the financial risks, 3 assignments are included within the plan for 2020-21. These relate to some of the key risks to the IJB having the correct information to inform decisions in relation to agreed improvement actions, which follows on from consultancy work that's been undertaken within 2019-20. The capacity of the current arrangements to deliver key priorities, and also the support that is provided to our commission service providers to ensure their sustainability. Some of these link in with what's already been seen by this committee in the COVID-19 risk register. I'd like to stress here that this plan is what we would anticipate delivering in 2020-21, and that's what I would like to progress. However, I would also like to highlight that it may be impacted by any further impact of COVID-19, of the COVID-19 pandemic, and that is something that I would bring forward to this committee if there was to be any impact on the delivery of the internal audit service. I don't anticipate that there will be at this point, but I just wanted to raise that with the committee now. But I'm happy to take any questions on the strategy and plan.
Okay, thank you. Can I ask if there are any questions from members on this report? Can I just ask first? Oh, I'll come to Councillor Duff in a minute. I just got in just before him. Chief Internal Auditor, you talked about the fact that some people were, or implicitly talked about the fact that some people were retasked in the earlier stages of the pandemic. I'm just wondering, has everyone been put back onto the internal audit function who were redeployed rather?
I can speak for Perth and Kinross Council. We are currently all now back doing our substantive roles. As of this week, we are all back on our substantive roles. Okay, so it's only if there were to be a further redeployment that might absolutely happen. Yes, or indeed any other requirements from within the partnership, whereby suddenly people were unable to actually accommodate internal audit within the timescales.
Okay, thank you. Councillor Duff, your question.
Thanks, Convener. Just a point of clarification, really. In Appendix 1, the final column has a grade column, and there's only one that has a grade down. It's 19 of 02, which is a grade B, but I don't see any kind of explanation of what range of grades there are and what they actually stand for.
Okay, that information is actually held within the audit reports. So when we look at, I think it's 4.5 within the report 4.5 from in this committee, there is an appendix which details what the grades are. Grade B is that of broadly satisfactory.
Okay, thank you. That's fine.
And I think perhaps the second part of Councillor Duff's question, I know that we discussed this as well, about why some of them don't have a grade at all.
With regard to, it does kind of vary. If work is undertaken which is a consultancy in nature, then we wouldn't actually have a formal grading. There's no formal report that will be considered by this committee. The reason for that is actually detailed within 4.4 on this agenda. Where consultancy work is undertaken by internal audit, which is within the remit and the definitions within the public sector internal audit standards, in order for the advice and support and guidance to be completely open and fluid, and also to encourage services such as the IJB to request advice, the independent and objective advice of internal audit for changes or developments. We feel it's unfair to then grade something, because usually when we are involved in consultancy activity, it's where services have identified that there are issues that they're wanting to address, and it's therefore unfair to actually then mark someone down, if you like, for actually asking for help.
Okay, thank you. Councillor Duff, does that answer your question?
Yes, that's fine. Thank you.
Thank you.
Thanks. Okay, can I just check, Mrs. Kilpatrick, on the phone whether you have any questions on this report?
Thank you, Chair. I mean, this it's a very well. The report lists a lot of audit activity, audit management, internal reporting, assessment of risks. As a non-audit person, if you like, what's a little bit what's a little bit vague to me is what these audits are and what they found, and the relationship between audit and risk and audit and performance. It doesn't really, as a committee member, it doesn't really explain to me. For example, we talk about clinical and care governance audit, right? Highlighted a number of areas. We don't see what any of these areas are in relation to hosted services or any other services that were audited. We don't, and I don't know if that's consultancy activity or it's audit activity. We don't say what they are or what the outcomes were, or is this an area that we have to revisit at subsequent meetings, or how does it relate to the clinical care governance structure? Is it then, are these areas, are these reports then is submitted to the Care Governance Committee and followed up by them. All I'm thinking is, as a member of the IJB, I can tell you there's a lot of audit activity going on, and I can tell you there's a lot of, I see from your report, there's your consultancy, but it doesn't say what any of the inputs, outputs or outcomes, and even what areas you're looking at. So I'm not really sure what's going on. I don't really have a handle on, you know, whether we're looking at prescribing or whether we're looking at mental health or whether we're looking at social care, or what is it we're looking at? Because it's very, it's all very, very high level, which is fine, but I come away from it thinking I'm not really sure what we're auditing here and what the outcomes of these audits are, and are these things that we as board members should be concerned about, are we looking at, should we be asking for further, you know, further investigation, or are they resolved, or, you know, you've done work in progress, draft issued and completed, and that's fine, but you know, is there any learning from it? Could anything be applied to other services? And that's my kind of issue. I'm not really sure what we're auditing.
Okay, thank you for the...
I'm a bit long-winded, Chair.
I think we got the question. Okay, Chief Internal Auditor, do you want to respond to that?
With regard to the appendices, the first part of the appendix is with the planned work for 2020-21, where, and that's the work that is currently being considered and that I'm asking you to approve as part of this report. The following appendices contain information regarding the previous couple of years, the internal audit activity that's been completed within the last 18 months or so, and relating to those two plans. Where audits have been undertaken, such as like the follow-up of the clinical and care governance, those reports have been considered by the Audit and Performance Committee at a previous meeting. So you wouldn't see that within this report, because this is really very a forward-looking report, looking at what I would intend to look at as part of the 2020-21 audit plan. So you would have seen the outcomes from the previous audits, and any actions would be picked up by the Chief Finance Officer and reported through the update on audit actions. So you'd see there where things have not progressed or are in progress. I don't know if that helps you to understand the final bits of the appendix. But you will have seen, as a committee, you will have seen the outcomes from those and what the scope of all those reports would be. The bits that you don't routinely see the outcomes for really is the audit management and audit planning, up until the audit plan itself being considered. And there's a lot of review work that goes on, looking at all the key governance documents that are in place within the partnership. And also looking at capacities within our own teams and within the teams within the partnership to accommodate audits at the appropriate time. So within the plan for this year, you know, there's 3 substantive audits plus finalising the financial risks audit from last year. Is there anything else that you'd like me to try and help and clarify?
Mrs. Kilpatrick?
Yeah, I mean, I just don't know. I still just don't really understand. I don't know what it is we're auditing. You know, I've read the reports and I've been at previous meetings and I'm at the IJB meetings. I couldn't put my hand on my heart and tell you, yeah, I know that we audited that. We had some concerns about that, or I'm just not really clear about that. I don't think this is probably enough detail for me, but maybe I could pick that up outside the meeting. I just don't think there's enough detail.
Yeah, I was going to suggest that might be an idea if you and I have a conversation outside as to what else I I could provide either here or just to get a better understanding of how the internal audit functions operating? Would that be helpful for you?
Yes, thank you. That would be helpful. Maybe we could do that. Yeah,
that's great.
Okay, thank you for that. And it's always very useful to have additional feedback on it. For my own clarity again, the reports like the one we've got at 4.5, for example, on performance management, once we've got the recommendations from those reports, they then go into the audit recommendations that we're constantly monitoring, as we've already done in early reports. So we do have an ongoing tracker on those, but I suppose it's just in these reports. I appreciate what Mrs. Kilpatrick's saying about it's not immediately obvious from reading that report what the work that has been done, but it is monitored in other places. Okay, right, thank you. Are there any further questions on this report? No? Okay, well, can we note the recommendations then that are set out at section 3 of the report? Okay, thank you. Right, if we move on then to item 4.4, which is the internal audit progress report, and going back to the Chief Internal Auditor to speak to this report.
Thank you, Chair. In line with the public sector internal audit standards, internal audit provides details of progress in the completion of internal audit activity to this committee as those charged with governance. As the committee is aware, there's been a delay in finalising work connected with the 2019-20 audit plan, and one report from this plan will be considered at a future meeting, with that being the financial risks audit. The outcomes of 2 assignments are considered by this committee, one as a separate report, which is at 4.5 on performance management, and here within section 2 of this report, I've outlined the outcomes from the consultancy work that's been undertaken in relation to the improvement actions. In order to ensure that, as I've already stated, in order to ensure the value of consultancy work to the partnership and to ensure that there is a greater openness to request independent and objective advice from internal audit, no separate report will be provided to this committee. But as you've seen from the plan which we've just approved, further work is being undertaken in the improvement actions, which is contained within section 2 of this report. Discussions have, with regard to the consultancy work, discussions took place and advice has been given in relation to setting appropriate and realistic timescales for completion of the improvement actions, given their number and the scope, and for ensuring that there's clarity of reporting of these to the IJB and to this committee. I'm happy to take any questions on the progress. But what you will see is that of the 3 substantive audits within last year's plan, 2 have been are now classed as fully complete, with one hopefully coming to the next meeting.
Okay, thank you. Can I ask if there are any questions on this report? Okay, no questions that I'm seeing from members who are online. Can I check with Mrs. Kilpatrick if she had any questions on this report?
My only question, Chair, was when we did the health service data report, and I see that we said we've approved the draft performance framework by the HSCT executive management team, but of the 6 key indicators, and I can't remember if it was just these 6 key indicators or it was all health service reporting that it was in the report. It seemed to take the format that it was, how did we do in 2018? How did we do in 2019? And then we could show a marked improvement in 2019-20 sort of thing, as opposed to what I would have said would have been benchmarking, which would have said, you know, how are we doing against similar sized HSDPs, or how are we, where's the 25th, what's the upper quartile performance in Scotland, and therefore how do we score against it? Therefore, you know, are we in that upper quartile performance, or are we doing better than we were but still in the lower quarter performance? That wasn't, I didn't ever think that was very, that wasn't very robust in my view. That's a personal view. And I just wondered if Audit had a view on how that was reported and whether they had recommendations on that.
Sorry, I'm not quite following which part of the report you're at.
I'm on point 15 on page 53 of 62 on the performance report, where it talks about joint work.
I think you're a paper ahead of us. Sorry, that's all right.
I'm on the performance report 4.5.
Still on 4 point. We're still on 4.4.
I'm sorry. Yeah,
no
my
problem.
apologies.
I was just getting myself slightly confused there, but that's fine. Come back to the question if that's okay.
After missing the first part of the meeting, I'm now a paper ahead, so I do apologise.
No, that's all right. Okay. Just to check, are there any questions on 4.4 then, or can we note the recommendations in the report then? Okay, right. If we now move on to item 4.5, which is the internal audit report performance management, and I'll ask the Chief Internal Auditor again to speak to this report. Thank you.
Thank you, Chair. The objective of this audit was to review arrangements in place for the adequacy and effectiveness of the measurement and reporting of performance. An audit found these to be of a category B, which is broadly satisfactory, linking back with Councillor Duff's earlier question. It was accepted by internal audit that arrangements are changing and developing, and going forward that these should be appropriate. The report contains details of the work that we undertook, with as Mr. Kilpatrick's already mentioned, the executive management team having approved a draft performance framework that's in place, and the IJB approving the performance process in February of this year. There is one priority 3 recommendation which has been accepted, and is fundamentally is a continuation of work which had been planned by staff within the partnership. With regard to Ms. Kilpatrick's particular question, I'm not sure whether the Chief Officer would want to address some elements of that. I think it's probably easier for him to explain than I.
Chief Officer.
I'm not sure that I agree that it will be easier than the internal auditor may have found. I'd be grateful though if Ms. Kilpatrick could perhaps repeat the question, because I was slightly confused in relation to both which report we were on, but your comments around the way in which we use comparative data was clearly a matter of some concern.
It was more about, as opposed to our comparative performance year on year, Gordon, and it was more, I would be looking for more robust Scottish comparisons, looking at what was upper quartile performance and how we performed against that, as opposed to the style of previous reports which have said year on year our performance is X, and generally our performance is improving, which is a good thing, and that's good. It's more about comparing ourselves against the top performers as opposed to comparing ourselves over a time series. And I've raised it before, Gordon, and I don't think it's very robust to just say year on year we're getting a wee bit better every year, which, you know, notwithstanding that is a good thing. It's more about, well, if I don't know, if South Lanarkshire HSCP is the same size and roughly the same composition in terms of rurality versus urban. Therefore, we compare ourselves. Is there a benchmark group? Do we compare it? Do we benchmark it? Are we, you know, is it aspirational enough, or is it just that a tracking over time? And that's kind of what I'm trying to get to.
Yeah, no, those are helpful clarifications and comments. Certainly, the annual performance report, which we'll be discussing later in the agenda, compares our performance in previous years, but also with the Scottish value, the Scottish average. But I think probably what we would want to do is exactly what you've described, is to think further about the opportunities for us to use some of the existing benchmarking groups that are around, and think about how we compare with the recognised family groups that we would be part of in terms of rurality or in terms of scale. I think at the next iteration, as we move forward with developing our approach to performance reporting, we would wish to think about how we could address some of that and you know, provide perhaps a richer set of indicators that would give members a clearer understanding of where we perform, not just in terms of the Scottish average and the previous year, but with those benchmarking partners. So we'll certainly look at how we can do that. And I know that some colleagues are connected in with other partnerships and with benchmarking family groups, which would lend itself to that approach. And the other thing that we need to reflect on is the opportunity to review how other health and social care partnerships are continuing to report performance and learn lessons from what's happening elsewhere.
Okay, thank you, Chief Officer. Ms. Kilpatrick, are you happy with that, or did you have any further questions?
No, I'm happy with it, Chair. I've raised it a few times before, and I think, you know, between audit and performance and Gordon's overarching role, I think we just need to start to put some drafts together of how that might look, and you know, what these benchmarking groups are. I mean, it's maybe even something that audit from an internal consultancy point could do to support Gordon in taking that forward. Is there a work involved in that? Thank you, Chair.
Okay, thank you. And perhaps you could also pick that up as part of your discussions that you'll be having with the Chief Internal Auditor regarding the presentation of some of these audit reports. Okay, we now have a question from Councillor Duff. Councillor Duff.
Thank you, Chair. My question was in relation to a couple of the IT issues that are reported. In page 52, on the second last paragraph, it talks about the business system team staff offering support to run specialist and regular monthly and annual reports. Is that the way it should work, or is that the way it kind of has to work? Is this a workaround, or is there a problem with teams actually running their own reports to get this information out of the system?
I think this is really seen as being helpful from pulling together the information that's held on different systems that the systems team are involved in, ensuring that information can be made available as a regular piece of information.
Yes, so to say that the support staff do that for the team, as opposed to the team being having the facilities to run it themselves.
At this point, yeah.
Yeah, okay. And over the page at 13.1, it also talks about you know, not having shared IT systems and a difficulty with diary synchronization. Again, is that an incompatibility of the systems, or is it just a technical issue that they're having in trying to synchronize them?
I'm not 100% sure whether there's technical capabilities to synchronise them. I'm not 100% sure on that one, which is why, you know, the systems team has got involved and is providing that information. It is very much a sort of a workaround. I don't know what kind of progress could be made to synchronise those, but it's why the support team are providing that.
Councillor, I can respond. Sandy Sotherland.
Thank you.
It's a technical problem. It's different systems, particularly around diaries. It's very much a desire that we all have the same diary availability. That's actually being resolved now with NHS Tayside, so we can have diaries common between health and social care. So that's all in hand. We're hoping towards the end of the year common diaries will be available for everybody to access. And as far as the systems teams go, yes, some reports are too complex to allow users to run themselves, so we still support users with complex reports.
I think the Chief Financial Officer also wanted to make a comment.
Just to build on what Sandy said, I think what is coming out in this conversation is a flavour of some of the complexities that we are dealing with in an integrated environment. We would want to move to a very much a self-service environment with our budget holder service managers being able to access simplistic and complex data sets in order to provide reports. But you know, that in the environment that we're working in is an ambition rather than a reality at the moment. Again, though, looking at the positives of COVID and how we've all worked together around digital transformation and use of data, it perhaps feels closer than it possibly has before. But probably the audit report recognises the complex environment in which we operate and the need for us to come together and create an environment where our budget holders, service managers can much more readily access data on a kind of self-service basis.
Okay, thank you. Councillor Duff, you happy?
Yeah,
with
thank you, Chair. Yes, coming from a police background, I recognise these issues quite clearly across you know, the various parts of the system. So I'm pleased that we're working to resolve these, which will make things obviously far better. Thank you.
Okay, thank you for that. I'm not seeing any further questions that people are wanting to ask. So with that in mind, are we happy to note this report?
Happy to note.
Moving on then to item 4.6, which is a verbal update from the Chief Officer on the Partnership Improvement Plan.
Thank you, Chair. Members will be aware that at the last meeting of the Audit and Performance Committee, we highlighted that there had been some challenges in relation to progressing what we had hoped to have progressed in the context in relation to our Partnership Improvement Plan. To remind members, the Partnership Improvement Plan is the plan that consolidates recommendations and findings from a number of different reports, from the Ministerial Strategic Group Self-Evaluation, from the Joint Inspection Report, from various audit reports, and from our annual governance self-evaluation. So we've collated these recommendations and grouped them in themes and have made steady progress in relation to a number of activities. But as the minutes of the last meeting highlighted, there have been challenges in making progress. We've therefore then, as I indicated earlier, taken the advice I think that came from Ronnie Erskine as one of the members of the committee to carry out a very detailed review of progress in relation to the Partnership Improvement Plan, to identify areas where there has been slippage, to realign existing capacity to priorities, and to identify where we need to build in some additional capacity. So that work's underway, and there are particular areas, as I've indicated, that we would wish to progress. important probably to note that the intention would be to bring forward an update in relation to the particular recommendations from the joint inspection report, and we have plans in train to review and progress some of those between now and either the next meeting of the Audit and Performance Committee, which I understand is scheduled for the end of November, or certainly this is intended to be a report to the IJB in December. So we recognise that we haven't perhaps made the progress that we would have liked, as described at the last Audit and Performance Committee, but since then we've done some prioritisation and are looking at how we can build in some additional capacity that will enable us to then be in a position to report more effectively on the progress that we are making. For work is going on behind the scenes to address some of these recommendations, but as we've indicated, some of those do link to what we were talking about earlier in terms of the strategic planning group, the audit recommendations that remain outstanding, and effectively COVID has you know, wiped out our capacity and our focus in relation to some of those activities. It just hasn't been able to be a priority to the extent that we would have liked. But we're committed to doing that now, and to be in a position to certainly report on inspection findings and progress in those recommendations, but more generally in terms of the other improvements that we've identified within the Partnership Improvement Plan when we next meet.
Thank you, Chief Officer. Can I ask if there are any questions from members on that verbal update?
No, that's very helpful, Gordon. Thank you.
Okay, thank you very much. With that, then we'll move on to item 5, which is the audited annual accounts 2019-20. And the first part of this is item 5.1, which is the assurances received from partners. And I'll ask the Chief Financial Officer to speak to this report. Thank you.
Thank you, Chair. Perth and Kinross IJB relies significantly on the effectiveness of the governance arrangements in its partner bodies, and indeed in respect of hosted services in relation to the other 2 IJBs. So we bring forward to the committee today the assurances that we have received from NHS Tayside, from Perth and Kinross Council and from Angus and Dundee IJBs to provide assurance to the committee of the effectiveness of their governance arrangements in 1920, that thereby supports the effectiveness of the overall governance arrangements for Perth and Kinross IJB.
Okay, thank you for that, Chief Financial Officer. Can I ask if there are any questions from members on this report? Reasonably self-explanatory. Okay, Mrs. Kilpatrick, I just want to check because you're on the phone. I know you can't indicate yourself. Okay, I'll take that as a no. Right, are we happy therefore to agree the recommendations and note the assurances that we have received, and also the fact that I will be writing to both the Council and the NHS, giving them assurance over our governance arrangements?
Agreed.
Okay, thank you for that. If we move on now to item 5.2, which is the audited annual accounts, and I think first the Chief Financial Officer and then perhaps from KPMG. Okay, thank you.
Thank you, Chair. Colleagues will recall that at the June Audit and Performance Committee, despite significant workload challenges, we were able to bring forward the unaudited annual accounts within the normal deadlines for approval. These were approved by the Audit and Performance Committee and passed to Audit Scotland to allow the external audit to commence. The audit has taken place from July, and I think it's fair to say, and I'm sure Michael will wish to comment, that that external audit has been prolonged with some complexity in relation to the impact of COVID. I'm going to pass it over to my KPMG colleagues to outline their findings in respect of the external audit. But before doing so, there are a number of people I would personally want to thank in allowing the accounts to come forward and be audited within normal deadlines. First of all, to thank KPMG themselves. They too have had to work in very unusual environment in relation to undertaking an external audit virtually, and we've worked well together, hopefully, to allow that to happen. I'm very grateful to them for the flexibility that they've shown. To PKC design team, who, building on our success last year in presenting the accounts in a user-friendly format, that could have been compromised this year because of the timescales we were working to, but the PKC design team have worked with us really well to make sure we could retain that user-friendly format, so I'm very grateful to them. But also to my own team, to Donna and the finance team, who have supported the external audit in difficult circumstances and have allowed us to get to this point within normal deadlines, and to support external audit and bringing forward their findings today. So without further ado, I'm very happy to pass over to Michael Wilkie from KPMG to present the external audit findings.
Thank you, Jane. And I'll turn to our report then in that case, which is presented in the appendices to the papers. I'm the Audit Director, and I'm joined by Chris, who's the manager supporting me on the audit this year. And I'll summarise our report and then take questions. But really, to echo what the Chief Finance Officer has said, it has been an unusual year and challenging for both parties to conduct an audit entirely remotely. With all the challenges that brings, even things like seeing audit evidence and obtaining it. So to have been able to achieve the original timetables in the context that Scottish Government did extend the deadlines for local government body type reporting, it is really a significant achievement, and we do appreciate all the help and time that the finance team have given us in order to be able to facilitate that, and to effectively report to the original planned timetable is an achievement, and one that not all bodies, I expect, will be able to ultimately achieve. Our report has a lot of context and broadly splits into two sections. The first concerned with the financial statements themselves and our audit work in that respect, and the second in respect of the wider scope areas required to give an opinion and conclusions on by virtue of our appointment by Audit Scotland. So I'll take the first part around the financial statements and the numbers, and then my colleague Chris will comment on those wider scope conclusions that we're required to give, and that leads on to some of the audit recommendations. I'll really just focus on one section of our report then, which is from page 24 of the supplementary agenda, or page 8 of our document onwards. This report remains draft until we issue our opinions, and ultimately I expect to be able to give an unqualified opinion on the financial statements, and that's having had due consideration of the significant risks which are unchanged from those we set out in our audit strategy and focus areas. We've identified no audit misstatements, that's either adjusted or unadjusted, and again goes to give some indication of the time and preparation which is evidently went into the financial statements. We've concluded positively on the significant fraud risk of management's ability potentially to override controls, and satisfied that we haven't identified any instances of that. And we rebut the risk that's presumed for auditors to exist in respect of income and expenditure recognition because of the way it is ultimately reported by the partner bodies to the joint board for inclusion in the financial statements. And similarly, it's by obtaining those confirmations from the partners that we're satisfied over the completeness and accuracy of the expenditure that's reported in the accounts. Our report gives quite extensive commentary on the financial outturn, which I don't intend to go through. Safe to say that we do recognise, I think consistent with prior years, that there are some challenges in, from our own perspective, reconciling and being clear on the various outturns when we talk about outturn to original budget, to the budget that's controlled by the joint board, separately from that in respect of hosted services, and to the budget or ambition in the financial recovery plan when it is implemented. And we've also noted the positive developments in terms of financial management, moving to longer term budgeting and financial reporting in the year. We give positive conclusions on the narrative reporting within the financial statements, so things like governance statement and management commentary. And lastly, on financial reporting, I should highlight that in the COVID environment, KPMG has determined that we have a presumption that in all audits, we would start from a presumption of at least a material uncertainty in respect of going concern. So there is one part shown in yellow within our report which wasn't concluded when we issued it and is now, and that is ongoing concern, where we had a mandatory internal consultation process. Now, in the context of the way the IJB is established, it is actually legally required to prepare accounts on a going concern basis, but nonetheless, the KPMG process was that I had to consult on that internally. And obviously our considerations there are more about financial sustainability than true going concern. The conclusion is obviously that we are satisfied the joint board is a going concern, but ultimately we requested and management have agreed to enhance the basis of preparation within the financial statements themselves, and that's giving some more context to the readers around why the joint board considers it appropriate to prepare accounts on a going concern basis. I wouldn't intend to say anything else on the actual financial statements, and I will either take questions now on that or pass over to Chris, who will speak about some of the wider scope conclusions.
I don't know whether any members want to ask questions specifically on that now, or whether they want to wait until the end.
Can we wait till the end, Chair?
That's fine. Okay. Thanks.
Good morning, everyone. I'll take you from page 30 on the supplementary papers, which covers our findings and conclusions over our wider scope and best value sections of our report. So overall, we were broadly satisfied with financial sustainability, financial management, governance, transparency, and value for money, as summarised on page 30. Wanted to echo Michael's commentary on the changes on the budgetary process. It was one of our recommendations last year, and it's clear that the finance team worked incredibly hard to bring forward a full budget for consideration by the 31st of March. As part of that budgetary process, we had a couple of recommendations that were made as part of our appendix. It covers building in a reserve strategy in the longer term, and really ensuring full partnership working to help support that. Obviously, with a financial recovery plan, which is now 3 years, which is also an excellent development, it really really support that integrated working. Our other recommendations cover development of a risk sharing agreement, which we understand will be moved forward as part of the renegotiation of the integration scheme. Strategic and corporate planning capacity, which has already been discussed at this meeting, so I won't go over it again. And the changes in membership to the board. One final comment from us. As part of our audit strategy, we commented that we would do some work mandated by Audit Scotland covering fraud and corruption in procurement. Due to COVID, we agreed with management that we would defer this to next year, just to ensure that all management's legal obligations to complete financial statements and deliver services was achieved, rather than look at this particular best value section, which we didn't think was a high risk anyway. So we will just defer that to next year. And I'm happy to open up to questions if anyone has any.
Okay, thank you both very much for those presentations on the report. I'll ask if there are any questions from members of the committee on either of the areas that have been covered. Councillor Duff.
Thanks, Convener. If I could just preface my remarks with a couple of comments. I think we should recognise the two significant achievements, if you like, in here. Firstly, as auditors explained, at actually getting the accounts delivered with no misstatements to the auditors within the normal timeframes, given the circumstances that we're all experiencing now, was a significant achievement, which I think we as board members should also recognise. And secondly, obviously, in terms of the actual outcome, that we started the year with an expectation of 4.2 million overspend. The financial recovery plan predicted that we'd be down to 3.3, and we've actually ended up with 1.8 million overspend. It's a lot of money still, but I think given where we were at the outset, I think it is also a significant achievement worth noting. My question was partly explained, but I would like some further information about what a rebuttal presumption is. I'm not quite clear, obviously, a layman when it comes to these kind of things, but it was a strange kind of term which I just would like some further explanation about, if that's possible.
Okay, not sure who wants to take that. Okay.
Yeah, I'm happy to take that one. So the rebuttal presumption is effectively that we are required to assume it is a significant risk in every single one of our audits. That is just effectively all it means. So we always consider that management override of controls is a potential significant risk, and our work always covers this risk throughout our audit file and audit opinion.
Okay, so you're rebutting it, as it were.
We did in this case.
Yes. Okay. Thank you.
Any further questions, Councillor?
I'll pass this now. I'll have a look through my notes and I'll come back to you.
Okay. Mrs. Kilpatrick, can I ask if you had any questions?
No questions, Chair.
Okay, thank you. One of my questions, I suppose, actually is probably more for officers of the IJB rather than from KPMG, but it was about workforce planning, which has come up again later on in the report as one of the areas that still needs to be addressed. I know this is something that we've been talking about for some time, and the deadline was March this year. It's not really something that would necessarily have been affected by COVID-19. So I'm just wondering where we are with that. I think the report just says that we'll continue to review the action, because I know that it has been a concern for board members in the past about ensuring that we have the appropriate arrangements in place to have staff for various services going forward, I suppose, to put it simply.
So, Chair, I could perhaps add something to that. We had some discussion at our executive management team last week, because what we've had to do is produce a document in relation to the workforce planning activity that has been undertaken in the context of COVID-19. So we've looked at retasking, we've looked at where we've had particular challenges or pressures, and we've done some resilience and business continuity planning in that regard, informed perhaps by the potential of a second surge and the challenges around winter planning. This has very much helped us recognise that workforce planning needs to be advanced. As you've indicated, it was something that we were looking to do in the context of the national developments around the integrated workforce planning strategy that had been developed by the Scottish Government. We recognise this is an area that needs to be developed, and we'll continue to try to progress work in this regard. It perhaps does link back to some of the challenges that we've alluded to in relation to capacity, but we absolutely recognise that the challenges are very significant in terms of our ability to succession plan, in terms of both clinical staff, doctors, nurses. We know the challenges that have been experienced in relation to trying to recruit consultant psychologists and psychiatrists, and there are also challenges around mental health officers and in social care. So this needs to be something that we focus on in the coming months, and we've committed to do so. And we will no doubt be looking to identify the optimum time to bring back a report on the progress that we've made in this regard.
Okay, thank you, Chief Officer. A couple of questions for KPMG now then. One was on the recommendation in relation to board membership and discussions that I think you had suggested to have with the partners who are responsible for appointing members to the Integration Joint Board. I think my question here is, no one would disagree with the ambition to have a membership that is consistent, because clearly that helps, and the corporate memory that we have in place and having to retrain people does cause problems. I suppose I'm just wondering, from a practical point of view, particularly in relation to the council, where appointments are made on a political basis and clearly changing compositions of the council has an impact on that. I'm just wondering whether that's a realistic ambition to have.
I think we made this recommendation, and we have to be careful to make it a recommendation which is to the joint board and one that the joint board can enact, rather than a recommendation that applies to a partner. I accept that it's a challenge. I think, though, our responsibility is to highlight that it has been unstable, and that instability or changes in membership, it causes a challenge in training and in taking longer term strategic decisions. All we can recommend is that the joint board, from a good governance perspective, raises that challenge with the partner bodies and reminds it of it. I know that practically that may not have a significant impact, but I think that is the good practice point that the joint board itself can take.
Okay, thanks. Sorry, did someone else come in there? No, okay. My second question was linked to that, but was on the transparency of the Integration Joint Board, and you talked about having the appropriate governance and scrutiny arrangements that were in place throughout the report. I'm just wondering, you know, I think that on the whole, the Integration Joint Board conducts itself in a transparent manner, and there is a lot of scrutiny. There are examples of in recent years, in for example, the mental health meeting that was cancelled in July last year, and also we have, which I'm sure you'll be aware of, and other examples of the budget, which I know you refer to, which was taken by email chain. And while that was as a result, justification was as a result of the COVID-19 measures, it would have been possible to hold that meeting virtually, as we're doing now. So I'm just wondering why you didn't feel that there was at least a minor concern about the need to ensure that decisions are taken transparently, and perhaps that had been happening in all cases.
I do appreciate the point. I think, though, our overall sense and conclusion remains that the joint board aims to conduct its work in a transparent way and take steps to do that, and that those have been relatively isolated circumstances, some which have been subject to, I would call it, disagreement as to whether it was actually a failure or not. But I accept the point. I think, though, our conclusion remains valid, that the joint board does aim to conduct work transparently.
Okay, we disagree on that specific point then. I'll ask Councillor Duff if you had further questions then.
Thanks, Chair. Well, not a question, just an observation. At the bottom of, I think it's page 32, there seems to be some text, it's certainly in my copy anyway, that slipped off the bottom of the page. It says, we considered the arrangements in place for the prevention and detection of fraud too, and then there's nothing beyond that. I'm not sure what's supposed to be there, but it's just an observation that The end of that sentence seems to be missing from the report.
We'll update it. It does say, I think, be sufficient, but it's behind the KPMG logo, so we'll make sure it's formatted in the final.
Ah, right. Yes, I can see it now, hiding there. Okay, thank you.
Okay, thank you, Councillor Duff. Can I just double check then if there aren't any further questions from members? Okay, well, thank you very much both for your presentation and indeed for the report. And I think that, are we asked to, sorry, the problem with not having papers to hand, it's very difficult to scroll through sometimes. If we just confirm then that we're happy to approve the audited annual accounts for 2019-20 and approve the letter of representation for signature by the Chief Financial Officer.
Happy to approve the recommendations, Chair.
Okay, thank you. And in the absence of any alternative comments, I'll take that as agreed. Okay, thank you very much. If we move on now to item 6, which is performance, and specifically to item 6.1, which is the Perth and Kinross Health and Social Care Partnership Annual Performance Report 2019-20, and I'll ask the Chief Officer to speak to this report.
Thank you, Chair. I am also having the same difficulties with finding my place in the papers because of not having a printed copy. However, I would wish to recommend and commend this report, our annual performance report, to the committee. This sets out the performance that we as a Health and Social Care Partnership have achieved in relation to the national health and wellbeing outcomes, and we've sought to incorporate in the later sections progress towards the achievement of our strategic commissioning priorities. Members may well recall that it was recognised at the last Audit and Performance Committee, and indeed has been acknowledged by the Scottish Government, that the publication of these reports could be delayed slightly in light of the response to COVID-19, and this report has therefore then been produced for today's committee. Important to recognise that the period covered by the report is the period up until the end of March this year. So in many respects, the performance that we are reporting covers a period that was mostly unaffected by the pandemic, except in those last few weeks before towards the end of the financial year. The report includes particular information in relation to data on key performance, as I say, in relation to the national health and wellbeing outcomes, and in relation to the key recommendations from the Ministerial Strategic Group. It also includes information that we have garnered in the course of the year, and this is interspersed throughout the document, feedback from people who use our services, comments, complaints, compliments that we've received. One of the later sections has our priorities for improvement. And if I could just turn to particulars in the report, there's a bit of background and contextual information before we see the detail in relation to, on page 117 of 156, a summary of our relative performance based on the national indicators and the Ministerial Strategic Group indicators. I'm very encouraged and pleased to report that we are seeing consistent high performance or good performance in relation to the majority of these indicators. 17 of the national indicators we've identified as green, and 4 of the ministerial, the MSG indicators. There are, however, some areas where we would wish to improve, and those are obviously identified in the context of the amber and red risk ratings. By way of background, just to point out that the 9 health and care experience survey indicators are collected every 2 years. So we have included the information from the previous period. However, the 10 activity indicators are derived from operational data that are collated and presented monthly. If I could turn to the next page of the report, which for me is page 118 of 156, we see here the performance in relation to the indicators identified. We've got all but 2 of these are in green. The 2 areas where we need to review our performance, consider what the factors are that are contributing to a decline, are in relation to the readmission rate into hospital within 28 days of discharge, where we're performing less well than the Scottish value, and as a consequence of emergency admissions, the indicator number 20, the relative spend on hospital stays when patients are admitted following an emergency. We're optimistic and reasonably confident that some of the community infrastructure developments that we're building in, particularly through our new integrated care service, will seek to address some of those challenges and place us in a better position in future years. Page 120 gives a summary of the performance in relation to the MSG indicators. These reflect good performance across all indicators, with, again, the exception of emergency admissions, which we'd referenced earlier. Beyond that, the remaining sections of the report provide the committee and will provide the IGB and the public with an indication of performance in relation to the strategic objectives that we set out in our commissioning plan that was approved at the end of last year by the IGB. And these talk about our performance in relation to the various strategic priorities, working together with communities, early intervention, prevention, addressing health inequalities, etc., and draw some links across to how these contribute to the national health and wellbeing indicators. I wouldn't want to go through those in any great detail. I'm hoping that members will have had the opportunity to read the report. I'm very grateful to colleagues for the work that they've done in bringing the report to this stage. There are 1 or 2 issues that we know that we need to address that we've picked up through proofreading and also through feedback from some members and some critical friends that we've asked to look at the report. Very grateful to the work that Jane Smith's led, to the contribution that Sandy Strathern and Chris Jolly have made, as well as some other colleagues. Sandy and Chris are both on the call today and may well be invited in at some point to help me answer some of the more difficult questions. Thank you very much, Chair.
Okay, thank you, Chief Officer, and I'd just like to echo some of the comments that you made towards the end of your introduction to all the officers for their efforts in bringing this together, particularly given the various other challenges that people have been having to deal with at the moment. And just very briefly, I'll summarise some of the comments that I have made. I had the opportunity to speak with Sandy Strathern and Chris Jolly, as well as Jane Smith, last week, and just gave some feedback in relation to the report. On the whole, it is very good, and there seems to be a lot of good progress, and on the indicators we seem to be performing quite well when we compare to the rest of Scotland. But I did ask, particularly when we're thinking of qualitative analysis, that we try to have some more constructive criticism from our service users, and also look at areas for improvement throughout the report, rather than just identifying the specific indicators where we aren't performing as well, and also to look at some examples of best practice in relation to the localities and the local action partnerships, because I think some are having stronger engagement with the Health and Social Care Partnership than others. So those are some of the comments that I made, but very happy to open it up to either questions from members, or indeed if they would like to make some comments on the content or format of the report, so that officers are able to incorporate that in their final draft. Okay, sorry, my chat jumped down a little bit. Councillor Duff.
Thanks, Chair. Again, trying to work my way through the papers isn't always easy, but on page 124, it talks about a lack of services in rural communities and the investment in the Mindspace counselling services, and at present these cover Auchterarder, Crieff, Kinross and Blairgowrie areas, and I wondered if there were any plans to extend the service up into the Highland Perthshire and surrounding area.
Who wants to take that?
Thank you, Chair. Councillor Duff, I think your point's well made. Mindspace are one of the organisations with whom we provided some additional funding in response to COVID. I am in a position, unfortunately, to be able to assure you that that is the area, or those are the areas that they're looking to extend to. But I shall find out exactly what the implications are of your question, and I'll perhaps need to defer and come back at a point in time. It's a very important element of our activity, because you'll see at various points in the report we've highlighted a recognition of access deprivation in rural and remote communities. The challenge that we placed on the third sector organisations who we provided additional support to was both around how can you engage with people who might not previously have had mental health issues but do now because of COVID, and how can you extend the services that you currently provide into other parts of Perth and Kinross. So in terms of that latter response, that latter challenge, there may well be something to report, but I'll, if you don't mind, come back to you after the meeting and provide you with information in that regard.
No, that's fine, Gordon. Yes, obviously, you know, these issues have been exacerbated through COVID-19, and I think given that represents a sizable area of the rural communities within Perth and Kinross, it would be useful to have access to the services more locally in the Highland Perthshire area. But I'm happy for you to come back to me on that. And the second one, a question I have, Chair, if that's okay to carry on, was on page 136 with regards to the iMatter survey. And again, I thought they were very positive results. I just wondered if the survey was done pre-COVID-19 or post-COVID-19?
It was done round about, well, certainly pre-COVID, so some months before COVID, because we're now talking about doing it again 1 year on, or planning for it being delivered in the next couple of months. So it was probably about 10 months ago. Yeah,
no, that's fine. I just was interested to know whether the staff are answering the questions in light of the new normal, if you like, with the way we're working under COVID. But it'd be interesting to see the results in the next one. Thank you.
Okay.
I have one final question, if you.
On you go, Councillor Duff.
Yeah, and that was on page 144. There's talk about an outstanding care inspector report for Dalweem. I believe that's obviously been deferred as a result of COVID, but I wonder if there was any timescales for that report coming forward.
I don't have any details. Obviously, the care inspectorate suspended their routine inspection activity during the pandemic and probably haven't yet picked that up. I'm not sure if Diane Fraser is with us at the moment. Yes, she is. Diane may have some more up-to-date information in that regard, because we're in touch with the care inspector every week, particularly in the context of care homes and obviously infection prevention and control and staff testing. So Diane, I don't know if you're able to provide an answer to Councillor Duff's question on that.
Thank you. We don't have a further date yet for Dalween, but certainly we are working with them closely, the care inspectorate. We have, Dalween have been involved in the assurance visits that we've been undertaking, along with public health and partnership staff. So, and again, the care inspectorate are involved in those regular meetings. So at this moment in time, we don't have any concerns around any of the care or quality issues in Dalween.
Okay, thank you.
Thank you, Councillor Duff.
Chair, can I just...
Yes, Chief Officer.
A shameless plug though for Dalween. I think we need to recognise the significant work that's been done by Dalween in Parkdale, you know, the council-run care homes, as well as the broader care home provision across Perth and Kinross. But I was interested to read in last week's Courier that the esteemed actor Brian Cox was talking about the excellent care and support provided to his sister, a resident of Dalween, which, as well as being reported in the Courier, was the subject of a discussion that he had with Lorraine Kelly on breakfast television. So a recognition from international actor on national television that the care and support being provided at Dalween was felt to be exceptional, and I couldn't resist or miss the opportunity to draw the attention of the committee to that point.
Okay, thank you for that, Chief Officer. And I think the first and last time that Councillor Duff and I will agree with anything that Brian Cox says. Okay. Can I ask if any other members have questions on this report or any comments that they would like to give on the annual performance report?
Can I just come in on that? Can you hear me? It's
Yes.
Bernie. Yeah. Yes? You can hear me? Sorry, I'm hoping I'm looking at the right report, but I'm looking at page 40, and it's in relation to the Mental Welfare Commission, and it's just really a comment which seems a bit confusing to me. It talks about the review at from the Mental Welfare Commission for the Morden wards at Murray Royal Hospital. And the first paragraph talks about very positive feedback received from the inspectors in relation to staff engagement, support, patients' involvement in meaningful activities, etc. But the paragraph underneath then says a total of 8 recommendations were made in relation to improving care planning, prescribing, monitoring, patient involvement in planned activities. So I just thought, unless I've misunderstood, but it seems a bit contradictory to the first paragraph. Have I read the right report?
Sorry, I'm just trying to, again, with these PDFs, find the right place.
Page 148 of 156.
Right, thank you. Chief Officer, do you want to pick that up?
Yes, I'm happy to. Chair, I maybe should take your advice on this. My potential conflict of interest, my wife has recently been appointed the Chief Executive of the Mental Welfare Commission in Scotland. However, was not at the point when this report was produced. And at the point that this report was produced, the inpatient services were the responsibility of the operational responsibility within Perth and Kinross. What I would say is that I think that the comments about the very positive feedback, Bernie, were specifically around the ways in which staff engaged and supported patients, and patients were involved in meaningful activities. And as it indicates, patients themselves spoke positively about the support and commitment from staff. But that does not detract from what, as you've highlighted, were key recommendations in relation to improvements that needed to be made around those areas. So I suppose It's important probably in the context of balance to highlight that there were some positives about this inspection, but equally these are areas that are fundamental to the provision of good care, and as you'll see there, an improvement activity has been advanced in the context of those recommendations. What we haven't done though is, and we maybe need the advice from the committee in this regard, we haven't provided a lot of detail in relation to some of these particular inspections. It may well be that those were picked up in earlier reports to the IJB in the context of wider work around improvement in inpatient mental health services. But we certainly were assured at the time that the improvement activity that was demanded from these recommendations was underway, and is now no doubt continuing to be advanced with the oversight now of Kate Bell, the Interim Director of Mental Health, which will likely be the subject of a follow-up visit by the Mental Welfare Commission in due course. But beyond that, I wouldn't probably be in a position to comment. We can perhaps, should the committee wish, provide more detail in relation to specific actions that have been taken in response to specific inspection or regulatory visits, if that was necessary. But I'll take your view on that.
Well, I think first, can we check, did that answer your question?
Well, yes, I suppose it did, but I mean, I was really saying that it's confusing. The first paragraph says very positive, and then it talks and naming things, and the second paragraph refers to the recommendations, which is really saying in the first paragraph were very positive. So in what Gordon has said, I mean, I would have just simply said that you would change the word very to some. So there were some positive feedbacks in relation to, and the recommendations below, which refer to the feedback at the top, would seem a bit better, but that's just my personal. I just think that very positive feedback, I'm sure it was good feedback, but the 8 recommendations refer to what is highlighted as very positive feedback, which seems just a bit contradictory, but as I say, but thank you.
Thank you for that. I think that ties in with maybe some of the comments that I made earlier on about trying to take a more balanced approach to these reports, when it's not just talking about all the positive feedback. While the recommendations are included there, I think you're right that it's perhaps a bit jarring. So perhaps Sandy Strathairn and Chris Jolly can take those comments back and reflect them in the report. So thank you very much for those. Can I ask, are there any further questions on
Can I come in, Chair?
Yes, Mrs. Kilpatrick.
It goes back to the section of the report, Gordon, that deals with A&E and delayed discharges, and it's just not necessarily anything wrong with the report. I mean, obviously the way that it's presented, it's in the green, so it looks good in the sense that it's within the anticipated levels that we would have expected in year-on-year increases. I suppose it's more about how we will set our performance for the forthcoming year, given that we've learned lots of lessons about near me and ways to still see patients and still triage patients and still work out which patients need to be seen, which can be treated online. But I think we will need to radically rethink our approach to how we manage these patients, and we've seen this dramatic decrease in A&E attendances because people were basically frightened to go to hospital, and I'm not suggesting that that's a good thing either, because we missed a lot of important cases and we missed a lot of unwell people, but there has to be some radical rethink about our performance against both delayed discharges and I think A&E attendances, particularly when we know that a much more significant proportion of these patients could be treated in different ways and avoid having to go to A&E, especially if we have continued resurgence of the virus. people will, you know, we don't want to encourage people to go to hospital that don't need to be there, but there has to be something a bit more radical in there, I think, and it's not any reflection on this report because it's good, but I think maybe just going forward how we approach that as an IJB. That's my comment, Chairman.
Okay, thank you. Chief Officer, do you want to make any comments on that comment, or?
Yeah, so I think these are really valid points. I mean, I think the first thing I would do is highlight the significant improvements in relation to delayed discharge in Perth and Kinross, not just in the period covered by this report and its comparator with the 2 previous years, but for 4 or 5 years now. We've gone from potentially something like 19,000 bed days lost down to the figure that's reported in this report, around about 12,000. Now, you know, that's commendable. That's a consequence of the work that we've done in developing a more robust community infrastructure. That's a consequence of the work that we're doing in the hospital in consultation, in collaboration with colleagues in acute division, and through a multidisciplinary approach that ensures that people can be supported to go home or to move from hospital as quickly as possible. Now, important probably to note, as I would emphasise in relation to any of these statistics, that the important thing for us should not be necessarily a reduction in the number, but actually a reflection on the fact that this is making a difference to people's lives. This is improving outcomes, rather than people remaining in hospital when they're medically fit for discharge. We are now effecting that discharge more swiftly, getting people home to better outcomes where they're safe and independent and able to be supported. So I think that human story needs to be amplified to a greater extent in some of the information that we present. But moving particularly to Pat Kilpatrick's points, which again are really helpful because they both challenge us in relation to how we will report in future. But of more significance, they challenge us in the context of reimagining what the new health and social care landscape is going to be like, and how in the context of COVID we can capitalise on the things that have happened that have been positive, and that we can find a different and more effective way of delivering those services. So we're acutely aware of the need to look at that. We're learning lessons all the time from our experience of COVID. We're working effectively with partners to think about how we can support people more effectively at home. I think the contribution of health and social care partnerships to the whole system has been highlighted through our experience of COVID. And this will no doubt mean that we won't be in a position to compare like with like in 12 months' time when we produce a report like this. We'll have to have a lot of contextual information about how the landscape's changed, and some of the benchmarking may well be affected by that. But Pat's comments are very well made, and an important reminder that we need to reflect on moving forward as we deliver and design new service responses in the context that you've described.
Thank you, Chief Officer. Can I just check, Mrs. Kilpatrick, whether you had any further comments on the report, or whether that was everything you wanted to say?
No, that's great. Thank you. I'm grateful for your response, Gordon, and for all your hard work on this. Thank you.
Okay, thank you. Now, I'm not seeing any further requests for questions or comments. So can I ask that we agree to approve the annual performance report in light of some of the comments that have been made, which I'm sure officers will seek to reflect in their final draft. So are we happy to approve the report?
Agreed.
Agreed? Okay, thank you very much. We just have 2 things left on the substantive agenda, which is just for information, which is the work plan for the Audit and Performance Committee for 2020-2021, and also a record of attendance for the Audit and Performance Committee. Can I just check whether anyone has any questions or comments on either of those 2 documents? Okay, that's fine. And just before we conclude, can I ask whether members of the committee want to have a private discussion with the auditors, either the internal or external auditors, if they have any issues they want to discuss?
No issues.
Could I maybe ask if the internal audit would send me an email of when would be a good time for us to have a bit of a chat about the issues that I raised during the meeting? That's all really. I don't have any need to discuss anything with the external audit, Chair.
Yes, yes, Chair. I will contact Ms. Kilpatrick.
Right, okay, thank you very much everyone. Well, that concludes the meeting of the Audit and Performance Committee today. Thank you very much for your attendance. The next meeting will be on Monday the 30th of November. Okay, thank you very much.